Gigantism and acromegaly due to XQ26 microduplication and GPR101 mutation. Introduction. Gigantism is the excess of ingrowth hormone that occurs before epiphyseal fusion. Acromegaly, instead, is a genetic disorder that affects the somatic growth network and can lead to increased secretion of growth hormone. The somatic growth is an orchestrated by complex hormone crosstalk involving the hypothalamic, pituitary, and peripheral tissues. XQ26 microduplication. Gigantism is associated with heritable microduplication on the chromosome XQ26.3. So, if exists a microduplication, is probably to cause gigantism. GPR101 mutation. GPR101 encodes an orphan G protein coupled receptor. This is the gene that drives the phenotype in young children and the growth of a sporadic growth hormone, producing adenomas in some patients with acromegaly.
Acromegaly is a hormonal disorder that develops when your pituitary gland produces too much growth hormone during adulthood. When this happens, your bones increase in size, including those of your hands, feet and face. Acromegaly usually affects middle-aged adults. In children who are still growing, too much growth hormone can cause a condition called gigantism. These children have exaggerated bone growth and an abnormal increase in height. Because acromegaly is uncommon and physical changes occur gradually, the condition often isn't recognized immediately, sometimes not for years. If not treated promptly, acromegaly can lead to serious illness and even become life-threatening. However, available treatments for acromegaly can reduce your risk of complications and significantly improve your symptoms, including the enlargement of your features. Signs and symptoms of acromegaly. One of the most common signs of acromegaly is enlarged hands and feet. People with this disorder often notice that they can no longer put on rings that used to fit and that their shoe size has progressively increased. Acromegaly may also cause you to experience gradual changes in the shape of your face, such as a protruding lower jaw and brow, an enlarged nose, thickened lips, and wider spacing between your teeth.
Applications in medicine. Determining the cause of gigantism and acromegaly in medicine helps us to find the right treatment. Also is important because each cause triggers different symptoms and complications. With microduplication, patients present an earlier median age of onset of a normal growth, 12 months versus 16 years. Also, increased acceleration in height and elevates level of insulin-like growth factor number 1 and prolactin. This study demonstrated that the fragment of the gonadotropin release hormone could be ligand for the GPR101. This protein may also play a role in the hypothalamic control of energy homeostasis.
Acromegaly is a rare hormonal disorder that develops when your pituitary gland produces too much growth hormone, nearly always as a result of a non-cancerous, benign tumor. Acromegaly occurs in adulthood, usually during middle age. In children who are still growing, too much growth hormone can cause a condition called gigantism that leads to an abnormal increase in height, as well as excess bone growth. Acromegaly symptoms: body odor, carpal tunnel syndrome, decreased muscle strength, weakness, easy fatigue, excessive height, when excess growth hormone production begins in childhood, excessive sweating, headache, hoarseness, joint pain, large bones of the face, large feet, large hands, large glands in the skin, sebaceous glands, large jaw, prognathism.
Pros and cons. Pros. GPR100 mutation wasn't found in families with familial isolated pituitary adenomas, and some of the patients with early onset gigantism had a normal elevated levels in circulatory growth hormone release. In the cons, the recurrent GPR101 mutation in 11 of 248 patients with acromegaly was found mostly in tumor. Also, patients with gigantism without X-cure present the disease before ages of 5 years. In Ecuador, in 2014, 48 cases of acromegaly was found. 35.4% was in males and 64.5% in females, and probably 80% was due to the GPR mutation. Gigantism affects 6 of 100,000 people in Ecuador.
Gigantism, the GH makes your long bones grow very large, obviously, but it also has some other effects. There is also an increase in muscle and visceral development. Now, it might be funny, well, not funny, but more interesting for you to hear that even though there's an increase in muscle, there is not an increase in strength. In fact, people who have gigantism are usually very weak. Very intimidating, but very weak. Now, as far as assessment goes, you have to remember that you can be dealing with children for the most part. As far as subjective data goes, as a nurse, you're going to want to assess their understanding of the disease process, as well as their emotional state, and if they can even verbalize or express their feelings adequately. You're going to also want to see how they interact with their family and what coping mechanisms they developed to deal with their disease process emotionally and practically, with their activities of daily living or ADLs. We know that kids can be mean, and if you're the class giant, it can take a toll emotionally. Frequent measuring is also going to be routine, and prognosis for people with gigantism is looking promising thanks to medical advances. But unfortunately, they still have a lot shorter life expectancy than the average person.
In conclusion, with this study, we discovered that pediatric disorder that is caused by an XQ26 genomic duplication and is characterized by early onset gigantism is resulting from an excess of growth hormone. Duplication of GPR101 probably causes X lack. Also, we found recurrent mutation in some adults with acromegaly.
Treat acromegaly? Well, you need to remove the source of that excessive growth hormone. So if you have a pituitary tumour, you can do an operation where you go transsphenoidally or through the nose and the sphenoid bone at the front of the face and surgically remove that pituitary tumour. And that's the definitive treatment for acromegaly in patients who have pituitary adenomas. Where acromegaly is caused by ectopic hormones from, say, a pancreatic or a lung cancer, then surgical removal of those cancers is also an effective treatment. If it's not possible to remove the cause of the excessive growth hormone, then there are medications that can be used to block the growth hormone. There's a medication called pegvisomant, and this is a growth hormone antagonist that's given subcutaneously and daily. More commonly, we use somatostatin analogues, which also block growth hormone. And remember that somatostatin is known as growth hormone inhibiting hormone. And an example of the somatostatin analogues is something called octreotide. And dopamine agonists also block growth hormone release. So this is things like bromocriptine that you might have heard of being used in Parkinson's disease.